And thank you for watching Local, National, Global. I'm the host, Giovanni Haqani. In our last video, I had mentioned that I was going to be talking a lot about the healthcare or healthcare system or lack thereof. During this pandemic, if you, those of you who watch the national media like CNN, MSNBC, Fox, all the network channels, they're all very good at reporting the numbers and kind of updating us on how many cases and how many deaths and what the overall situation was pretty much throughout the nation. One thing, however, they didn't talk about was the main reason, the primary reason why I would say that we are facing the numbers, especially the number of dead that we're facing, is because of the lack of healthcare system. We do not have a preventative care system in this country. We have what they call a sick care system. People get sick, they run to the emergency or they run to a doctor or a community clinic and see if they can take care of whatever it is their needs are at that moment. That said, that inefficiency of having a healthcare system that provides basic healthcare to individuals, we are where we are today. The 550,000 dead are pretty large numbers if you look at it. They're so large. If you were to combine the First World War, Second World War, Korea, Vietnam, First Gulf War, Second Gulf War, okay, and combine their numbers together, and 9/11, we're still not close to 550,000 individuals dead. So I think you're getting the severity of what the situation is. Now, most of the individuals on the news channels are not going to talk about this. However, I'm free to talk about it because I am not controlled by any special interest, and I'm kind of free to express my opinion here because I'm an independent, no one controls me, there is no special interest there. So that said, I'm going to run some numbers as far as the case numbers, number of cases and the number of deaths in comparison to United States, and that way I could draw a comparison for you in what it is that I'm talking about as far as the desperacy that we're in right now for a national healthcare system. And it doesn't make any difference what you call it. I don't care if you call it single payer, I don't care what you call it, socialized care. Let's forget about the labels and let's really look at what the situation at hand is. Most of these deaths that we have, the 550,000 total deaths as of today, and well, today it was like 487 individuals died today, unfortunately. So when I'm looking at the other numbers and looking at the other nations that have primary care for their citizens, or I would use the term a national healthcare system. So Canada is one of them. Mexico is another. Let's just take North America for the time being here, and then I'll move forward to the other countries as well. That way you'll get an idea what I'm talking about. So Canada, there was 971,718 cases in Canada and 22,900 deaths. And then once when you bring that up to someone, well, most people say, well, Canada is only 34 million, approximately 35 million people, as the size of California. True, there is that difference there in the population. However, what we're looking at is ratios. Okay, I was just looking at ratios. So Mexico, 150 million people, right? Only 2.2 million cases. To be exact, 2,222,842 cases, 201,826 deaths. Now, let's say these numbers are a little bit fudged. Say Mexico is not giving us the accurate numbers, or maybe even Canada is not giving us accurate numbers. That said, I'm still looking at, even if you add something to it, their numbers are still quite a bit lower than United States. And the primary reason is, in these nations, whether it's Canada, Mexico, Japan, United Kingdom, Germany, France, most of these nations that I looked at all had one thing in common in comparison to us. They all had a national health care system, a preventative care system, not a sick care system like us. So the next few years, I'm going to continue to harp on this, because this is something that I feel that really means a lot to Americans. Most Americans are very dignified. They're very proud. They're proud of their, heritage, and they simply do not want to complain. And most of us are just in the United States sitting here kind of wondering when the nation is going to get around to a healthcare system. Obamacare, naturally, when Obamacare came in, Affordable Care Act, it was highly unpopular. I looked at many aspects of Affordable Care Act, or the Obamacare. I didn't like the fact they had exchanges and things like that. It further complicated everything, and there were many things related to the Affordable Care Act that just didn't make any sense to me. And I know President Obama tried. He did his very best to come up with a single-payer system, but he had a tremendous amount of pushback. And I'm not sure if Biden had something to do, the current president had something to do with knocking down the single-payer system at that time. But I kind of suspected it had someone in the background that was basically against a single-payer system or a national healthcare system. Moving forward, this pandemic was a pretty alarming thing to the nation, right? When we look at these numbers, we understand that these numbers could have been a lot worse. So instead of 550,000 dead, we could have had 1 million dead. And even more, because I remember Dr. Fauci and Deborah Birx walked into the Oval Office and mentioned this to the former president, that if you didn't do what we're asking you to do, you could end up killing 2 million people or more. And I don't think they were exaggerating. I think they were pretty accurate in their assessment, because the numbers, the predictions that they were getting were pretty dire. And judging from the fact that they didn't know very much about this virus, the only thing they knew was it was a pretty dangerous thing. It was a pretty dangerous virus, and it was nothing like they had ever seen. You take United Kingdom, 4,337,000 cases and 126,000 dead. And they have a national healthcare system there. It takes care of individuals. So there are a lot less individuals with pre-existing conditions, and that's why the numbers are so low. In the United States, because we don't have a healthcare system, our pre-existing conditions numbers were pretty high. And notice those are the individuals that were at the highest risk. And if you look at the 550,000 individuals that died from COVID-19, were basically with pre-existing conditions. Majority of them, I would say. Not all of them, but majority of them. So we're going to need to do some soul searching for the next year or two and look at these numbers and start putting pressure on a lot of our elected officials that we are going to we're going to come to a position where we're not going to be able to avoid a national healthcare system. We just won't. It would be a disaster in the next pandemic if we were to delay the national healthcare system. What that would do, now, people will always say, well, how do you pay for it? This is all, I don't want to get into all that at the moment. Right now, my primary focus is to make the case for a national healthcare system, regardless of what you call it. Whether you expand Medicare to cover more people and cover pretty much everyone, or you create an entire new system, scrap everything and start from fresh and look at other models like Canada, Germany, France, United Kingdom, and pick up, come up with our own model as far as what we need and what works for us as a population of sitting at 320 million people. And I'm not saying that we need to replicate someone else, but we are in dire need of a healthcare system. And going back a few years, in 2008, 2007, 2008, I remember in one of my booklets, I was running for state senate in New Mexico here, and I had mentioned that we are in dire need for a single-payer system. And I remember individuals that I was talking to as I went on my campaign, knocking on doors and stuff. People were pretty shocked that in 2007, 2008, I was bringing up a national healthcare system. And it wasn't just unpopular, it was pretty downright shocking to people that I had mentioned that in 2007. I have an actual flyer that I saved from back then to show individuals that how long I've been pushing for a national healthcare system. Those of us who are in the position to make this case, we need to make this case. Those of you who are watching who have their own shows, who have your own channels, and you have your variety of different shows, I'm sure, a whole bunch of you out there. Try to bring this point up for the sake of the nation. Just eliminate politics out of it, regardless of what we call it and how we state it, whether we call it something collective, blah, blah, blah. It doesn't make any difference. We are in dire need of a national health care that takes care of most Americans so they don't end up with pre-existing conditions. So once the next pandemic hits, and it's going to hit again sometime in the future, we are not facing the numbers that we're currently facing with 500,000 or 550,000 dead. Hopefully we'll be able to bring that number way below this 550,000 number. That said, let me move into the political side of it. The political side of it is it's pretty clear to most people. Those on the right, especially on the right, will say, "Well, no, this is all just part of becoming a socialist type of a nation, or this is something that's not going to work for us." And we are used to dealing with it the way we're used to dealing with it, meaning our some individuals have their health coverage and they're happy with it, and they don't feel like they need anything. On the left, you would go and listen to someone like Bernie Sanders, Senator Sanders, and there's other individuals there, AOC, Ocasio-Cortez. Many individuals on the left and far left would say, "Bring the single payer. Let's bring the single payer." All I would like to do is settle somewhere in the middle there, where we are covering pretty much everyone, okay, with the least amount of money, least amount of burden on that individual. Let's, and I don't want to get into the exact mechanics of it and see, okay, well, this is how we do it, or this is how we do it, or let's try to do it that way. I'm simply asking individuals out there at this stage, during this current pandemic, to start calling their elected representatives and ask them to start the dialogue for a national healthcare system. Regardless of what it is, we need a national healthcare system. And by calling your elected representative, those of you who are in other states watching this, please call as many elected representatives as you can locally. Your national representative, congressmen, senators, call them. And stress on the fact that we are in dire straits for a national healthcare system and they must do something about it. At least let's start the dialogue there. Let's start something there where enough people are calling. They're going to have to look at the numbers and say, okay, we tried to ignore this during the pandemic because the national media is pretty controlled and was told not to talk about that. You can see that's pretty evident. No one in the national media is talking about a lack of healthcare system that led to 550,000 people dead. So, but I'm going to talk about it. There's a lot of people out there like me, independent. I'm urging them as well, start speaking on behalf of a national healthcare system. And let's not worry about where we're going to call it, how we're going to construct it. Let the elected representatives at least get the ball rolling, and then we can take it from there. And I think I'm going to leave it at this right now, but there will be a lot more episodes that I'm going to be doing that will that I'll bring up a need for national health care so we can avoid all these large numbers that we had this time around in this pandemic. So that said, thank you for watching, and I will put out another video in the next few days, hopefully. And you already know, in order to help the algorithms, please subscribe and press the like button and share if you can, please. That really helps out, and then it helps spread the word. So thank you again for watching. I'll talk to you next time.